One of the most common questions that I get is, what is a C-section really like? And what is the recovery like? Usually my answer is that it is a lot more intense than most women expect. There is this misconception that having a C-section is the easy way out with childbirth. And I don't think this could be further from the truth, because while the physical intensity of a C-section during the actual surgery usually isn't as intense as a vaginal birth because the mother is numb from the waist down, the emotional strength that she needs to bring into that surgery, it's a lot. She needs to really trust those care providers. She might be dealing with a lot of fears and anxieties. So the emotional component is not to be ignored. And then, of course, the recovery. Typically, the recovery after a C-section is a lot more intense, a lot more painful than the recovery after a vaginal birth. So I say all of this because I have a lot of women that come into my class and they had maybe a C-section with their first baby and they report feeling like a failure, like they're not as strong as the women that had a vaginal birth. And it breaks my heart because that is not true. Women are amazing regardless of what type of birth they had. Every type of birth requires so much strength, so much trust, so much love. And so if you end up needing a planned cesarean, or you end up needing one, after you've already been moving through labor, I don't want you to feel like you are a failure. Know that you are still, going through a really intense experience, and it will make you stronger. But to feel proud of yourself, regardless of the birth that you have. So getting more into the specifics of what, the surgery actually entails. So one of the first components is potentially scheduling. So if you have a breech baby, meaning that your baby is head down, or you have another special circumstance that potentially puts your baby at risk, your care provider might recommend planning a C-section. They'll likely schedule this around your due date. If there is an emergency and they need to get baby out as soon as possible, then that C-section will likely happen sooner. An unplanned C-section, so this typically happens when you go into labor, you're laboring, you're hoping for that vaginal birth, but something happens that makes your care provider think that it would be safer to do a C-section. So if it is an emergency situation, personally, I recommend, doing whatever is best for you and baby and getting the baby out. If, again, it is a true emergency. If it's not a true emergency, if your care provider is saying, for example, we might want to start considering a C-section. It's not an emergency, but just think about it. Before just immediately saying, yeah, sure, let's do a C-section, I recommend asking them their reasoning for that recommendation, asking if there is, anything else you can try before going to a C-section. Because again, it is a really intense surgery that is sometimes absolutely needed for the well-being of mom and baby. But if it's not an absolute necessity for you, I recommend looking at the alternatives first before agreeing. Okay, so the next thing is consent. Regardless of if the C-section is planned or not planned, you will need to sign consent before you go in to have that surgery. Something else that is really important to remember before you go into that surgery is really focusing on a sense of trust. Remembering that all the surgeons, all the support staff, everybody in the OR, that operating room, they are highly trained. They know what they're doing. You're in good hands. Worrying about, their skill level and all of that will only freak you out. Really focus on that sense of trust. Know that you can trust them. Know that you are in good hands. Allow that trust to just wash over you before you go into the OR. Okay. Support during the surgery. So most often they will allow one support person in the OR with you. If you have a partner, that will likely be your partner. You can also have a doula, friend, a family member, whomever you choose. Of course, most women decide to have their partner there. But if your partner gets really squeamish and the sight of, surgery or needles or a scalpel makes them woozy, talk to them, if you have time. If it's an emergency, you just got to go for it. But if you have time to talk to your partner about it, see if they really feel comfortable being in there. If they feel uncomfortable, but they still want to be with you, maybe they could just sit right by you, right by your head, so they can't see, what's going on beyond the screen. But if they just feel really uncomfortable and you don't want the medical staff in the OR to have to deal with your partner, you want the focus to be on you, right? Consider having, again, a doula or another friend or family member be your support person while you're in there. And it's also nice to consider a second person, right outside the OR in the waiting room that you can bring in if your partner needs to go somewhere with the baby, because ideally you are never left without, somebody that you know and trust with you. All right, so next, okay. Pain and numbing medication. So in most cases, an epidural or a spinal block is used to numb you from the waist down before a C-section. In rare cases, general anesthesia is used, which means you'll, completely be out. That does not happen often. Again, usually it's that epidural and you are awake, you're alert, but you can't feel anything from the waist down. So before recommending, the pain medication that will be used, the anesthesiologist will look over your medical history. They'll likely discuss with you, what the best option will be, but you can most likely expect to have an epidural. I'll be doing a video soon about what an epidural looks like. All right, so further prep. So after the epidural is placed and they confirm that it's working, that you are completely numb, they'll likely insert a catheter to drain your bladder. You might be given an antacid to neutralize stomach acid. What else? Let's see, you might be given, or you will be given, an IV with fluids, and you might be given antibiotics as well to prevent infection after the surgery. And so the screen. So, after you're numb, you're feeling calm, a screen will be raised about your waist, maybe a little bit higher, and this screen prevents you from seeing the incisions, which is for most women a good thing, because it would likely cause some panic, some anxiety to see the surgery being performed. But one thing that you can consider is asking them to slightly lower the screen as baby is being lifted out, so you can see, their emergence into this world. And they can lower the screen to, a level where you can't see inside of yourself. You can just see the baby being lifted up. So that's something to consider. All right, so the surgery itself. So again, once they've triple confirmed that the epidural is working, you cannot feel anything, the surgeon will make a horizontal incision a little bit above your pubic bone, kind of just below the bikini line. So say you had bikini bottoms on, the scar hopefully would not be able to be seen unless it was a super low bikini bottom. So they make that incision, they cut through the underlying tissue, they manually separate the abdominal muscles, and then they make a horizontal incision in the uterus. They pull baby out, they remove the placenta, and voila, baby is born. This usually doesn't take any more than 15-20 minutes. It's fairly quick. It's pretty straightforward. And hopefully after that, you can start bonding. If you and baby are doing okay, baby can be placed on your chest and you can start, skin to skin bonding. There will be, somebody right there. Usually a nurse is monitoring that, just in case, the epidural medications are making you a little bit woozy, just to make sure, if something happens, there's somebody right there that can take care of baby and you, of course. So while you're bonding with baby, they will likely start the stitches. So absorbable stitches will be placed in your uterus, and then stitches or staples will be placed on the incision that was made on your abdomen, that outer incision. And then from there, once it is confirmed that you are doing good, you're recovering nicely from the surgery, baby's doing good, you'll be moved to a recovery room. And let's see, then you can start the recovery. Yay, that's exciting. So that's the gist of what the surgery looks like. I haven't gotten too deep into the emotional side of it because every woman responds to it different. If you have a lot of fear around being at the hospital, around being in surgery, around needles, around everything that a surgery entails, I really recommend doing some fear release, lots of, meditations. You can even listen to a meditation during the surgery itself. So you're not hearing the surgeons talking about what's happening. You're just in your own world. You can also put in music to just relax. If possible, if you really get a lot of anxiety thinking about the potential of a C-section, I recommend trying to find a counselor, a therapist that you can at least have 1 or 2 sessions with to develop some coping skills for that. Okay, so now on to the recovery. All right, so you're transferred to the recovery room. It will likely take a few hours before the epidural medications will wear off, so you'll be pretty numb for a while. Once it wears off, they'll likely have you get up and try to walk around a bit as soon as possible, go to the bathroom. When those medications wear off, you might start to have a lot of soreness, some pain in the incision area, possibly. And so your care provider will talk to you about pain management. You might be given opioids, and maybe all you need is something like Advil, Tylenol. But again, you can discuss that with your care provider and find the best course of action. But they're going to be monitoring you closely, making sure you're not in too much pain, making sure you don't develop an infection. You'll be watched very carefully. Feeding. So, once any pain is under control, you maybe are doing good. If you want, you can try to start breastfeeding if that's something you're choosing, or you can do the first bottle feeding. Most hospitals have a lactation consultant that can come on in and help you feel it out with that. If you're feeling kind of unsteady because of the medication from the epidural, of course, you want to make sure you have a nurse, you have your partner there helping to hold baby, making sure that everybody's good. Okay, so I already talked about how they have you get up and walk around as soon as possible. One of the reasons for that is to help prevent blood clots in your legs. They don't want you to be stationary for too long. They want you to, they're not going to have you go like walk a mile. You'll just probably walk around the room a little bit, maybe walk in the hall with somebody's support just to get the blood flowing. All right. So you'll probably be in the hospital for about 4 to 6 days after the C-section. And this is mainly just for monitoring, again, to make sure that an infection doesn't develop, to make sure, your pain stays under control. And when you feel good to go home and when your care provider agrees and feels that you are, good to go rest at home, then they will likely discharge you. And once you're home, you'll likely continue to have a lot of soreness in your abdomen, maybe still some pain in the incision site. They'll likely send you home with something for the pain. You will need to be on not necessarily bed rest, but be resting a lot for at least that first week, probably a bit more. You really need to feel it out. Each woman is different with her recovery. So I really recommend listening to your body, not pushing it. If you're really feeling sore, you're really feeling out of it, if you need to, have somebody get the baby for you, have somebody else be on diaper changing duty to really allow yourself to take it easy as much as possible. Hopefully to have somebody there to help bring you food, really allow yourself to be taken care of and nurtured as you're recovering from that C-section. If in doubt, call your care provider. So even if you're like, nah, you know what I'm feeling is probably normal, call them just in case. Trust me, they would rather have you call them about something that's totally benign than not call and have something serious be happening. So go ahead and reach out to your care provider if in doubt. All right, so one other thing I wanted to mention was exercise and sex. So, with both of those, you're looking at needing to wait at least about 6 to 8 weeks, potentially more. You'll definitely be going in for checkups with your care provider to see how you're healing, and they'll give you, an exact time frame from when you can start exercising and having sex again. But take it easy. Don't push it. Don't think, oh, I need to get rid of this baby pooch and start exercising. Just allow yourself to rest as much as possible. And so again, if you end up needing a C-section, please remember that you are not a failure. You are still going through an intense experience, and you are a warrior, you're a goddess, regardless of the type of birth that you have.